Welcome back to Western New York Living. It's a topic that's been in the news for close to a year now, the COVID-19 virus. Now that the vaccine has become available to more here in our area, more questions have been brought up. And joining us this morning is Dr. George Danakas from General Physician Women's Health to discuss the risk pregnant women might have as it pertains to COVID-19 virus and the vaccine. Doctor, thanks for being here.
Thank you for having me.
Well, the first question, Dr. Danakas, is about the pregnant women watching right now. I know there's some at home who want to know, what are the risks if someone is pregnant and they unfortunately contract COVID-19?
Well, this is a very serious illness, and if they contract COVID-19 while pregnant, they are actually at increased risk for intensive care unit admissions. Actually, statistically, they're threefold increased risk. Is about a 2.4-fold increased risk of mechanical injury to the respiratory system, and about 1.7-fold increased risk of actually dying.
So there is cause for concern for sure for women who are pregnant. Now, some may be able to receive the vaccine who are in professions where they are essential workers. Is it safe for pregnant women to receive the COVID-19 vaccine, and should they get it?
Yes, but I recommend anyone that the vaccine is available for, they should receive it. The potential benefits outweigh the theoretical risks. Unfortunately, there have been no studies done to date. The pregnant women were excluded from the initial vaccine studies. However, studies are ongoing, and hopefully we'll have some safety data soon.
What are the side effects of the vaccine that pregnant women should expect or could expect if they're able to get the vaccine?
Right. The most common side effects are fever, pain in the arm or discomfort in the arm, and maybe some like feeling a little achy, and fatigue is the big factor. With the first dose, there's probably about a 3 to 4% risk of developing a fever. And with the second dose, it's up to about 15-16%. But if they do develop a fever, they can take Tylenol.
And I wanted to ask a question too about, and some pregnant women might have this question about breastfeeding. If they plan to do so, can they still plan to do so after having the vaccine?
Yes, absolutely. There should be no risks to nursing.
And these are all questions too that patients should discuss with you or their doctor about the vaccine, correct?
Correct. Yeah, correct. It should all be fully discussed. And the only real reason not to take the vaccine would be if there's an allergy to the vaccine. And I know with the Pfizer vaccine, there's a slight subset of women that do have, or actually men and women, that have an allergy to the actual vaccination. And they would know that if they ever took a flu vaccine in the past and had an allergic reaction.
Well, this has been important and reassuring information, Doctor. We thank you so much for sharing that with us this morning. If folks have questions about the COVID-19 virus or vaccine, General Physician PC and General Physician Women's Health can help. They have plenty of information on their website at gppconline.com. To reach Dr. Danakas at his East Aurora office, call 656-4077. They also have the Kensington Avenue office you see there in Amherst. You can also go online to schedule an appointment. Now, coming up next, if you think I'm speaking softly, you might be mistaken. Diversified Hearing and Balance Centers will be here to discuss key signs your hearing may be deteriorating and the newest technologies in hearing aids. Stay with us for that information.
This segment of Western New York Living was sponsored by the following: